A new study has revealed that many hand sanitizer brands sold in Johannesburg in the early stages of the COVID-19 pandemic contained traces of toxic ingredients and less alcohol than required. We speak more on this report with Dr Boitumelo Kgarebe, Head of Analytical Services at the National Institute for Occupational Health, who produced this report. Thank you very much, ma'am, for availing yourself this afternoon. Maybe let's start with how the research was conducted.
Good afternoon, and thank you for having us to give you highlights of our study. Our study was actually motivated by anecdotal media reports that some of the hand sanitizers were not up to scratch, and then we also started getting inquiries with people wanting to make their own hand sanitizers, their own formulations, and asking us whether the formulations were the correct formulations. So after that, we decided to just go into the Johannesburg market, the shops, and just the hawkers, and collect some hand sanitizer samples and test them to see whether they are the correct formulations as stipulated by the WHO guidelines, as the World Health Organization guidelines.
You found that some of them contained toxic ingredients. What does that mean, and of what consequence is it to anybody that may have been exposed to these toxic ingredients?
What we mean by toxic ingredients means one, ingredients that should not be there, and two, that are harmful to human health. So we found these toxic ingredients in various amounts, and so they will be harmful if used continuously, so meaning that you're potentially exposing yourself continuously to things that should not be in the hand sanitizers, and in the long run, they will get in dermally through your skin and start affecting you. So that's what we mean by toxic exposures.
Where is the South African Bureau of Standards in this? Were these people that sold these hand sanitizers legitimate? I asked maybe in terms of, was there any vetting process before they actually got out to the public?
No, there was no vetting process. If you remember, when the WHO put out guidelines as to how some hand sanitizers could be made, people started going out and making out their own preparations. So to some extent, those that with the bigger markets and the bigger shops, etc., those were South African Bureau of Standards regulated, but the other ones that you found may or may not have been regulated.
You also point out in your research that exposure to methanol through both ingestion and transdermal absorption, if left untreated, can be extremely dangerous, leading to significant disability and death.
Indeed, methanol is a known alcohol, which when taken into the body or spread on your skin transdermally, methanol causes blindness, and it also causes other very serious consequences.
I'm not sure, ma'am, if this included the scope of your research, but do we know whether they're still being sold, and if people can access them on the streets?
As far as whether they can access the hand sanitizers on the streets, we are not sure. What we did do in our research is to collect a cohort of randomly selected 94 preparations, and those are the ones that we did work on and we analyzed. At the end of our paper, and I would really urge I would really urge people to look at our paper. It's quite a simple paper in terms of understanding, but we do say that, and I will quote, we say that consumers are therefore warned that among the many brands of hand sanitizers found in Johannesburg, there are some substandard preparations and some that contain traces of toxic ingredients, close quote. So they have not been taken, to the best of our knowledge, they have not been taken off the market. This was just our own internal research as the National Institute for Occupational Health, which is part of which is a division of the National Health Laboratory Services.
Has it, I'm sure it has, but I just maybe want to hear from you and not misrepresent facts. Has it been shared with the relevant authorities, I think of the Health Department, for instance, the South African Bureau of Standards, just for something to be done on this?
For us, as the authors of the report, of the scientific report, we have not as yet. It only came out on the 8th, I think, on the 8th of March. So we have not yet taken the step to share it with any authorities. But it is in a very, very highly reputable journal, and it is available for the authorities to read and possibly take steps. What we're very happy about is the media coverage that this paper of ours has gained, because then that is also part of the sensitization, A, of the authorities, and B, of the general consumer out there.
Thank you very much for availing yourself this afternoon, Dr. Boitumelo Kgarebe, Head of Analytical Services at the National Institute for Occupational Health.